chronic inflammation, oxidative stress. What does it have to do with everything? It is a reason we have NCDs, non-communicable chronic diseases. So it's effectively what it sounds like. You can't catch them, you can just get them. Cardiovascular disease, cancer, obesity, insulin resistance. I would put in there pre-diabetes, type 2 diabetes, Alzheimer's, Parkinson, stroke, COPD, go on and on and on. These are all problems of stress, oxidative stress, chronic inflammation, lifestyle. If you look at the slide on the right, it shows you sort of a normal acute inflammatory response. Let's say you got injured, you were exposed to a virus, you got sick. Well, you want to have some inflammation. The whole purpose is to fight off pathogens, sequester them, destroy them, get them out of the system, promote healing, start the regenerative and proliferative processes. Well, what happens in chronic stress is you're consistently giving yourself cytokines, and oxidative stress is the pink lines. So you sort of have this low level of chronic numbers or high numbers of inflammatory cytokines and inflammatory problems, oxidative stress, free radicals, et cetera. So you're supposed to be where the yellow and black lines are way on the bottom, if not even lower. However, most of us in America and now in most countries, you're really living in this sort of no man's land where you have a ton of oxidative stress and free radicals and chronic inflammation, but it's not to the level that you get like when you have the flu, let's say, but it's not where it should be. This is where we don't want to be, and this is why I want you on the Mediterranean diet and taking antioxidants, reducing inflammation, reducing stress. You want to drop down to the black and white, the black and yellow from the pink. So by definition, again, NCDs are non-infectious. You're not going to catch diabetes from someone. They're non-transmissible. If you have diabetes, you can't give it to someone. They are associated, highly associated with low-grade chronic inflammation. 6 out of 10 of the top causes of death worldwide are these non-communicable diseases. Now think about that. It is also the leading cause of disability. Back pain, number one cause or one of the number one causes of disability in industrialized nations. Now there's a whole host of legal reasons why that's true, but the reasons backs hurt is chronic stress. And the leading cause of epigenetic damage. What are epigenetics? Well, this is when DNA is methylated and transformed even while you're in utero. And you can affect a child's life even before they're born by what you're eating. So around this green circle just sort of shows you who you are if you have the chronic low-grade inflammatory phenotype, which means type of person, which can be changed. So sarcopenia disability, these are the people that have no muscle mass when they get older, the little old ladies that are prone to falling because they're so weak. Frailty, people with atherosclerosis, stroking out. Immunosenescent dysregulatory infectious, all that means is they have no immune system when you get older. Neurodegeneration such as dementia, Alzheimer's, et cetera, cancer, anemia, depression highly associated with oxidative stress and chronic inflammation in the brain, and of course diabetes.